Thank you for joining us for Health Talks. I'm Gail Hogan, and sports medicine expert Dr. Larry Nolan is here to tell us about the expertise found only at Ohio State for sports and activity-related injuries. Thank you for joining me, Dr. Nolan.
Thank you for having me.
What are some of the most common injuries you see?
We see a wide range of orthopedic sports injuries at our urgent care. We've seen sprains, strains, ligamentous injuries, meniscal injuries, even some bone injuries with some of your more common fractures.
Do you see them in kids that play sports and older adults who think they can play sports?
We see a wide range of athlete, fortunately, coming through our doors.
What about some of the more unusual cases you see?
Yeah, we're pretty fortunate that because of the providers that we have orthopedic trained specialists that are seeing these injuries, and so we're able to handle even the most uncommon injury coming through.
How can we prevent injuries? I mean, even for students as they're in high school, or the older active adult and they start playing, a different sport or a different, like all of a sudden they're going to play pickleball. What should they do?
Yeah, definitely. I think one of the things they can start with is reaching out to their physician to see if there's anything that they need to, look into with as far as cardiovascular health or pulmonary health, those kinds of things. But as from a musculoskeletal standpoint, they can really just kind of start, and I think I would encourage them to do. Rest is rust. We want to keep people moving, and if unfortunately they do suffer an injury, our doors are wide open and they can walk on in.
I like that, rest is rest. I will keep that in mind. What kind of care should people get right away after they've received an injury?
Yeah, every injury is going to be a little bit different, and it's not, the patient's job to really triage it themselves, and so that's the reason we're there. If something occurs in the evening or during that day, we're able to see people the next day or the same day. So if they're able to come to our orthopedic urgent care, we want to get it triaged for them. The majority of injuries are going to be able to be handled by us that same visit. Sometimes if additional imaging is required or unfortunately a surgery is needed, then we'll be able to facilitate that for them and get them to the next step.
And if they don't seek help right away?
Sometimes that can lead to worsening injury and more complications down the road. So really getting seen acutely as fast as possible is one of the utmost important things.
Getting that care right away, how does that help the patient then in the long run and their outcomes?
Yeah, so long-term outcomes will definitely be improved, as well as their short-term outcomes just from being able to be seen by orthopedic specialists.
What kind of non-surgical treatment do you offer at the orthopedic urgent care?
Yeah, we will offer a number of different treatments, mostly some medications. There's different procedures we do, such as injections and other things, as well as get people plugged into our physical therapy groups.
If you can't help a person non-invasively, what next?
Then sometimes we will do some additional imaging, like I said, and sometimes, if a surgery or other procedure is required, we have some of the best experts in the area, and we're best able to get them facilitated to that.
Tell me a little bit more about those experts and the level of expertise that you offer.
Yeah, so we see pretty much every joint head to toe. We have a specialist here at the Ohio State University. We're very fortunate. So anyone that, if we have a specific knee, we have a specific knee surgeon for that. If we have a specific ankle, we have our ankle surgeons for that as well.
So besides the specialist, what other reason should someone choose Ohio State for urgent care?
Well, we do provide care for the Buckeyes, and so we expect to provide that same elite level of care to our patients.
So Ohio State has one of the largest and most specialized sports medicine programs. How does it feel to work at a place like that?
Yeah, we're very fortunate. I think, this area has a lot of good medicine being performed. I think it's a very, very fortunate thing to be a part of something this good.
Do you do research?
Yeah, we do a number of active studies currently and previously from a number of things, both from preventative medicine to actively treatments, surgical interventions, as well as postoperative care.
So then what about follow-up for these folks that go to an urgent care center?
Yeah, so one of the biggest things we pride ourselves on in the urgent care is also having a plan. So not just from the injury itself, but preventing it from coming back. So whether that's going to be physical therapy, following up with another specialist, this is one of the best ways to get the foot in the door.
And after hours if something happens?
After hours, just come on in the next day. We have the option for MyChart scheduling as well. So it's something that people can clue in to themselves and then have it ready to go the next morning.
What if a patient needs urgent care in the evening or on the weekend?
Yeah, fortunately at The Ohio State University, we have a number of other locations for advanced urgent care that can handle similar musculoskeletal injuries.
So what if someone goes to the primary care physician first? Mm-hmm. Can that primary care physician refer them to you?
Yeah, absolutely. We would welcome that. Obviously, we trust our colleagues in primary care, and we would happy to assist, but definitely a great referral source. Sometimes other referrals can take some time. This way you can get your patient seen the next day or the day of.
Great. Thanks, Dr. Nolan. Thank you for talking with us.
Thank you.
And thank you for joining us for Health Talks.